You're sitting there complaining about these big carriers, and that's what you're offering your employees. Isn't there a disconnect? Like, yeah, matter of fact, there is. And so now some of them have been led to believe they're not big enough to offer that to their employees, which of course is wrong. So that's been an exciting development to see providers as employers themselves. And hats off to the DMOS folks.
Yeah, I just feel like our conversation with employers is just changing. In our previous life, we would have, here's your renewal. We can raise your deductible. We can move to an HMO. You can ask your employees to pay more. You can pay more, or you can do a combination of all these things. And those are not sustainable solutions. And so now the solutions that we're having with our clients or prospective clients is, here's a direct primary care doctor coming to a meeting with us and talking about true healthcare. We're not talking about more insurance. You don't need to buy more insurance or jump from this carrier to the other carrier. It's bringing people that work in healthcare to the conversation that I think is really going to solve this thing. And that's, hence the community connected health. It's, in any given community, there are businesses, there are people, there is usually healthcare, whether it's a hospital or, primary care and so on and so forth. So when you talk to some of these groups, they all hate insurance because of how expensive it's gotten, usually second or third, largest expense. You talk to the people that work in healthcare, they hate insurance. So it's like, well, hey guys, how about this? We all sit at the same table and we figure this thing out by removing the insurance aspect of it and create as many direct pay relationships as possible. And, there's, to your point, through the work that you've done in identifying various TPAs and PBMs and, other organizations that, we're bringing into this blueprint or custom building health plans. There are some that will operate in a fiduciary manner and some that are just in it for the profits. And we need to be able to sniff those people out because it's even, I was just at a conference and there's always a story I feel like with some of the new vendors that are coming into the space of someone, similar to you, where you've got a story about a friend that, was diagnosed and, hearing stories about, someone that was on a life-saving medication that was $60,000 a year, and they created a solution to make it more affordable for, other people that are in those situations. And so it's those are the organizations that we want to try and, latch on to that are, are in it for the right reasons, no different than, what Mike Keeban came out and said, why he is getting into it.
Yeah.
So it's getting, to kind of backtrack on what you were saying, it's just getting to the point where, the everyday American can't look away of how much we're spending on healthcare. I mean, what is it? 4.5 trillion.
It's true. It's actually up to 5.3 trillion.
5.3. Okay, it just keeps rising. And like I said,
People are spending more on healthcare than their mortgage or their car
yeah.
or food. I mean, it's bonkers.